The United States leads the world in biopharmaceutical innovation. In fact, over the past 2 decades, drug companies in America have delivered just under half of the world's new drugs. It is therefore imperative we preserve the broad policy environment that has been so successful in making America the world leader, especially at a time when we're looking to turn the page on a 3-year pandemic and gear up for a cancer moonshot. Life sciences companies depend on revenues earned from one generation of innovation to finance investment toward the next generation of innovation. Yet drug price controls constrain the ability to earn those revenues. This is why virtually all academic studies find that a reduction in drug revenues leads to decreases in future research and new drug discoveries.
Drug development is an extremely risky business. About 8% of those drugs that enter trials ever make it to market. It takes 10 years and about $3 billion to develop a drug. And if you cut off the payoff to development of those drugs, you will get less drug development. The only question is how much less, but the direction is unmistakable. In the end, that entire system is driven by the ability to recoup the return on a risky investment if it turns out. And it turns out very rarely. 92% of them fail before don't get to market. And so these are very risky bets. They take a long time to develop. And if what you get at the end of the day is the promise that the money won't be there, the money at the beginning will dry up, the small firms won't exist, and the big firms won't have access to new therapies and drugs to sell.